Welcome to Athletic Conceptual Training Podcast. It's an honor to welcome Dr. RuthAnn Lobos, veterinarian, elite triathlete, and a respected leader in pet nutrition and rehabilitation. With over 2 decades of experience shaping veterinary communications and wellness at Purina, she's championed science, compassion, and innovation. Today, we'll explore the hard truths, hopeful visions, and bold conversations shaping veterinary medicine in 2025. Dr. Lobos, thank you for joining us.
Well, thank you for having me. And I feel like you should be my hype guy with every intro. That was fantastic. Thank you.
I'm glad you liked it. Um, so let's just jump into the questions and just really get to know you and get to know, your outlook on some of these questions. Veterinary burnout is often spoken about, but rarely acted upon. Why do you think the industry continues to celebrate suffering in silence?
Yeah, that's a great question. And I think that probably even expands beyond just veterinary medicine. I think that's a lot of our hustle society that is encouraged in whatever profession you happen to be in. I do think some of it within the veterinary industry has a lot to do with the person that it attracts and the type of personality that it attracts, with that high drive, that want for recognition and for feeling like a superhero. And I would say, while I do work for Purina, I'm still in a clinic a couple of days a month. I just was yesterday doing relief work. And there is that adrenaline rush, at least that I get, when you do really, you help that patient, you connect with that client. And I think that's what is kind of like the drug that keeps us staying. And for those in practice full time, that it kind of fuels that. And you can get so wrapped up in that moment that sometimes taking that step back and looking at, okay, what is that doing to the rest of my world? Whether that's my family, my hobbies, my friends, all of that, when I'm continuing to push and drive myself in this one specific area. And so that's where I think, again, it's that drug that doesn't want us to, or that we don't let ourselves oftentimes step away from.
Yeah, that makes sense. If we don't change the current system, what will the vet profession look like in 10 years realistically?
Yeah, I think very much broken. I hate to say that. I have a 10-year-old son, and I have many friends who have children in kind of the age of this next generation of professionals. And so many of them are encouraging their children to not go into this profession. And so I think if we don't change it, if we don't change that embrace of the hustle mentality, that it's going to get real broken. I think we are making leaps and bounds in the communication factor of things. And so kudos to you and your efforts on helping other folks understand what we as veterinarians experience, and then vice versa with working on our communication skills. I mean, when I graduated, it's been more than 2 decades ago, but we really didn't have much of, except for maybe like a half-hour credit course on client communication. And that is the crux of what you do in practice or in any part of this industry. And so now that has started to shift, I think that's a really great positive attribute that's going to come, that we're going to see start to help to flourish and really help this profession stay alive. The more you understand someone else, the better the world can be. So I think that will really help to save us.
Yeah, agreed. Is it ethical for clinics to be open 24/7 where there are no sustainable staffing models? Who's truly benefiting from the system?
Yeah, I mean, I think it's such a tough one. I think now with information coming at us 24/7, and us being so connected to our pets, and also with all of the technology that can connect us to our pets as well, and starting to understand them more. I would say it is a necessity, right? Like there has to be those clinics that are open 24/7. But to your point, I mean, I think it is a little frightening if you do have a dog or a cat or a hamster that is in a critical situation and you bring them to an emergency clinic. It's not helping the perception of veterinarians if when they go there, there's no one staffed there. And so I really do think, again, it's got to be one of those, almost of the onus on that veterinary clinic that is 24/7 to say, after hours from whatever it may be, 9 to 6 in the morning, we are triage, and there may not be a veterinarian on staff. And so that's all, that's a big part, again, of that communication of what is that client going to be expecting when they walk in the door at an emergency clinic. I would expect, if I put myself in the shoes of a pet parent, that I'm going to be able to talk to a veterinarian immediately. And so it's working on that communication of setting the expectation if they can't staff 24/7.
Yeah. Do corporate veterinary partners silence veterinarians' freedom to speak openly about certain treatments or diets?
Yeah, so I would say I don't have a whole lot of experience working top to top with corporate veterinary practices, but I can say from the experience that I've had, whether that's doing relief at a practice that's owned by a corporation or consulting with some, I have found that they make recommendations, but the ones that I have worked with thus far have always been like, the end of the day, that communication or that preference of treatment or whatnot, it's your license that's on the line. So you have ultimate control and say. It may be a little bit maybe more difficult if there's a particular diet or supplement or some sort of thing that they want to prescribe. They may have to outsource that or something of that nature from an online pharmacy or something that it may not be stocked in-house. But for the most part, I have seen that they do have freedom to practice and treat how they feel, one, most comfortable, and two, most appropriate for the patients that they're seeing.
Yeah, I would definitely agree with that. A lot of autonomy to make decisions and pivot, and one thing that I feel like I would say is that for the most part, there are multiple options for treatments, food, things like that. So, yeah, I agree. With major pet food giants funding most of the nutritional research, can vets really give an unbiased dietary advice, or is the science too tied to sales?
Yeah, so I would say that's probably one of the biggest misperceptions. And I know I'm jumping the gun here in your list of questions, but I will say, working for Purina, I don't get invited into the behind the scenes of some of the other big pet food companies. So I will come with my Purina experience. And when we do fund the research, whether that's partnering with Colorado State or Cornell or whomever, we are funding that professor in that endeavor that he or she is looking to really try to understand better. And that's where our influence ends, as far as like, we sign the check and turn it over. And then we let science take the path that it will. And then it's really looking at when it's published in a peer-reviewed journal. Obviously, the pet food company does not have a stronghold on the veterinarians and the researchers who are reviewing the results and the setup of the study and all of that. So that's where I think the crux or the truth really comes through, is when it does get published in a peer-reviewed journal, and then it has been evaluated by a third party that is unbiased to where the funding came from.
Yeah, I think Purina does a really good job at that. I mean, obviously, they are one of the bigger giants,
Yeah.
so to speak. But I, I think that they're really good about just like you're saying, turning over. Here's the funds, make it happen.
Yeah.
Yeah.
And there have been studies where it's like it didn't necessarily turn out in, that our maybe diet or approach or whatever was like made everything better. And that still
Hmm.
gets published, and we will still, because I think, again, the more we know, the more we understand. And if we're helping to really unlock some of the mysteries of what nutrition can do,
Hmm.
then we're all better for it.
Right. Right. So what we're trying to say is Purina is the way to go.
Exactly.
Um, should we rethink how pet insurance works or doesn't work for actual medical emergencies?
Yeah. Well, I would love for more people to actually like embrace it for their pets. I know I've done a post on this, but for as much as I have talked about it, probably in the last 10 years of my career, it really wasn't until 3 years ago when I had learned the hard lesson of not having pet insurance, and my French bulldog decided to make two very bad life choices within the span of about 8 weeks of each other.
Oh
And all
no.
of a sudden, I was like, holy moly, gosh, I wish I had pet insurance. So I think that's the first step, is to have a few more people adopted. And I think we're getting there, for a whole host of reasons. I do, I don't ever really want it to be something like it is in the human space. I think that's where oftentimes, having had some broken bones and surgeries and things like that through my athletic career, and knowing that oftentimes it is the insurance that will tell the doctor how to treat. I don't want that happening to me as a veterinarian. And so that's where I'm like, I don't know that I want it to go how it is on the human side, and just knowing the workload that it puts on physicians and, in those different medical professionals, because they have to deal with those insurances. I do think there's areas where I have seen that they are starting to get a little bit more nitpicky about things, and claims that are submitted. And so I do worry that, if a dog comes in for an ear infection once, that now is a pre-existing condition. And
Hmm.
so if they break with like chronic food allergies 3 years later in their life, that the insurance company is going to say, nope, you had an ear infection when you were 6 months old, so we're not going to cover any of this.
Hmm.
And that's where the part gives me a little bit of pause. But I think if we can continue to partner smartly and educate those insurance companies as they are starting to get more claims, I think there's an opportunity for us to do things right, both by the pet as well as by the pet parent.
Yeah, I totally agree. Is there a insurance that you're partial to?
I mean, I can tell you, like, for me, my pets are on Embrace. I don't get any kickbacks. I have no real affiliation. I just started to kind of look at things. I was with some other companies that started to raise the monthly rate, even though I had not submitted any claims for my dogs.
Mhm.
And so that was kind of when I started to dig a little deeper. I
Mhm.
know there are some that are doing things where they're partnering with particular softwares that veterinary clinics are using. So it makes it a little bit more
Mhm.
seamless for
Mhm.
the client as well as the veterinarian themselves. But I have found that also comes with a premium attached to it. So I think it's really important for the pet parent to do their research, and then also talk to their veterinarian about what their experience is with the different insurance companies before really jumping in with that.
Yeah, thank you for that great information.
Yeah.
Switching back to the food, is the raw food movement a legitimate health option, or is it just a wellness trend fueled by fear and misinformation?
The raw food question. Yes.
Dun, dun,
So
dun.
if I take my Purina hat off, which I do when I'm in practice, and I go in as an unbiased veterinarian, I would say, or I come in with my own personal bias. Everybody's got them. My concerns with true raw food diets is their ability to be complete and balanced. And that's what I love about kind of the traditional pet food, whatever brand it is you choose, is that it's got that correct nutrition for the species, for the life stage. And we've seen, actually just yesterday when I was in practice, there was this puppy who came in. It was a 7-month-old boxer puppy, a boxer mix puppy, super skinny, was kind of had off and on limping. It was coming in because it had gotten in a dog fight with its neighbor. But as we start like talking more with the owner, well, she'd been home cooking for the dog and intermittently raw food diet. And it turned out he had some skeletal malformations that were happening because he had been on this home cook / raw diet. And so that's, we see that in practice. And so that's my one concern with raw food. The second concern is the fact that a lot of these, the bacteria that we cook out of the diet, why we don't eat raw chicken or eat raw beef, like Pasteurella and E. coli, they stay alive in the GI tract of the dogs and cats. They might not get sick from them, but they stay alive. And so, again, knowing how much our pets are part of our families, and I mean, my dogs sleep in my bed with me, and I'm like, I don't want extra bad bacteria like hanging out near my pillow or on my comforter. So those are my two big concerns when it comes to those raw food diets. And it's really both about the health and well-being of the dog and cat, but also the health and well-being of the pet parent that is cohabitating with them.
Yeah, I love that, and thank you for educating the community on that. Yeah, such an important question.
Yes.
How do you personally navigate the tension between clinical science and marketing when educating pet owners?
Yeah. So educating pet owners is a big part of my responsibility at Purina, and then also obviously when I'm in practice too. And so my goal is to help them to understand why marketing claims are the way that they are, and why they put certain things on there. And when we take a step back and we think about it, it's like, okay, our pets need nutrients. They don't need specific ingredients per se, but also our pets are not buying their own food. They're not, they're not coming into the practice with a credit card attached to their collar. It's like that. There is that human component to this whole trifecta. And so marketing, pet food companies will make marketing claims and will have these messages because they have to communicate to the human who is purchasing that product. But I do strongly, so, when we're talking pet food and people often ask me, is this a good brand? And I'm like, sometimes there are new pet food companies that I have never heard of. They pop up all the time. Yeah. And so I'm always like, there are two pieces of information that are so important on there that can help you as an individual sort through the marketing claims that are on the package. And the first one is the phone number of the manufacturer. And I always encourage, I'm like, one, look if there's a phone number, and two, when you're standing there, take your cell phone out and dial it and call and like see if there's a human on the other end that you can talk to. Yeah. Because by law, they we just have to have our address on the bag. There doesn't have to be a phone number. But that is, you want a phone number, you want a person on the other end of the line so that you can ask them some questions about how they manufacture their food, where they do it, who formulates those diets. And so you can start to kind of, you say, if I feed this food, my dog is going to live till they're 30. And you could pick up the phone and say, y'all say this on your package. Is it true? How do you know it's true? Do you do research? Those sorts of things. And then the other piece is that AAFCO statement, making sure that it's complete and balanced for either a dog or a cat, and whatever life stage, whether that's adult maintenance, or maybe you have a puppy or a kitten, and so you need a growth diet. And so checking that AAFCO statement is also going to be critical in helping to sort through that marketing.
Yeah. Wow, ladies and gentlemen, a lot of good information here. Veterinary medicine remains one of the least diverse medical professions. What systematic walls still exist, and what needs to be disrupted?
Yeah. And it's funny because if you would go back like 30 years, right, it would probably be, this is such a male dominated profession, maybe 35 years. And now it's very much female dominated, and so it's an interesting kind of, having been on the tail end of, when I graduated, I think we were like 2/3 female, 1/3 male. So it was closer to being balanced, but still trending in the direction of, of being more female dominated. And, so now trying to see, like, how do we get the pendulum to swing a little bit back the other way, right? And I don't necessarily have a fantastic like unlock for that, but I think it's something to start to look at of, what made it switch this way, and how do we get that balance, because there is that diversity of thought, right? And then there's also, when we look at, I think the biggest barrier is when we look at the financial implications of going for a doctorate degree, and those that may not have as great of an opportunity because of that financial burden that's associated with it. And seems like it's only going up. And I would love to see that there is an opportunity to kind of reset that mindset of how expensive going for a doctorate needs to be, has to be, could we reverse it somehow? And then the third piece to that is looking at greater incentive from an appeal to the rural population. And there's so much that's focused, and I mean, that's an economic trend that has existed for eons, right? Of like, the cities are the epicenters. But I feel like, again, that bringing both folks in from the more rural areas, as well as then supporting those rural areas in a greater way through more advanced care, is a part, I think, that really needs to be shaken up.
Yeah. A lot of great points touched on. I think one of the things that resonates with my mission is just representation, and then exposure. Just getting a little bit more education and communication about the field as a whole. This wasn't something that was presented to me. And so yeah.
Can I ask you a question?
Of course.
How did you get into veterinary medicine?
Yeah, and it's funny because it's actually through my dad, because my dad, he trains dogs, and he partnered with a local police station, and did protection work and obedience and things like that. So, and then we've always had dogs, so I was naturally interested in the why behind it. I didn't want to go be a dog trainer, but I wanted to understand how to help those pets. So
sure.
Yeah.
Cool.
Yeah. But yeah, I mean, again, like without that, understanding of how to guide my curiosity, so to speak,
Yeah.
um, I think that we could do a better job at, from the schools, they can go recruit and, be a little bit more proactive about communicating the field to students and
Yeah.
kids. I think as bigger companies could be better at targeting the youth,
Yep.
as far as in the same way. I think hospitals themselves could be more proactive in targeting the youth and educating,
Yeah.
do a walkthrough day or a quick visit day, especially when and I've, studies show once you engage the community in a diverse way, your revenue stream just skyrockets.
Yeah. Yeah.
So it's a win-win situation.
Right.
Yeah.
Exactly.
Tough question for you. Maybe not a tough question. Have you ever felt that being a woman in leadership within within veterinary medicine came with unique challenges or resistance, especially when representing a major corporation?
Ooh, that's a great question. I mean, I would, it sounds so stereotypical, but very true in the sense that when I was pregnant and then right after having my child, I have always traveled for work for Purina. So I've always been remote. I currently live in Boulder, Colorado. Purina's headquarters are in St. Louis. I've never lived there, despite going there often for corporate meetings and such. But that was one of the kind of challenges of now I have a newborn, and a small child, toddler, but yet I'm still being asked to. At the time, I was in a role that I was doing a lot of international travel, and really had this was more about my manager at the time, and really trying to help that person to understand that, like, hey, there is more. There's more to the world than just pet food and being a veterinarian. I have a human life now that I am responsible for, and really trying to, they were not a parent. And so I think there was again, kind of keeping our conversation here on theme of education. And it was like, here's what I need to do as a parent, for this little human. And this is what it's going to require. I do feel fortunate. I use this phrase kind of a little bit with a little sarcasm to it, but it's like, we are not saving babies' lives. We are making pet food. So if I need to step away to take care of my human, it's going to be okay. But there is there is that need to really set those personal boundaries. And I think oftentimes, both in the corporate world as well as in the veterinary space, we are not good at setting boundaries. And, we'll give clients our cell phone numbers and whatnot. And it doesn't feel good to say no. But it is, it's essential for us from a human existence standpoint.
Yeah. Yeah. Work-life balance
Yes.
is a big topic, and I think it's something that the world is shifting into doing better. And I think the veterinary medicine field should catch up.
Yeah. Yes.
Yeah.
Yep.
I also did an interview on Mother's Day with Jessica Yatabi, and it was a very emotional and powerful interview, and she touched on being a mother in the field, and she had her child with her. Definitely check that one out, because
Okay. Yeah.
What you're speaking to is something, again, tying back in what we were talking about is, we don't have to basically kill ourselves in order to get our work done.
Yeah.
We can do both.
Yeah.
And especially moms.
Yeah, yeah.
So anyway, that's a whole nother subject. But I am in awe of all mothers who are able to naturally do what others don't understand.
Yeah.
Last couple questions.
Okay.
Where are the sponsorship dollars going, and where should they be going? Are the most impactful veterinarians getting support, or just the most visible ones?
Ooh. Um, I mean, so with my role with Purina, we sponsor, I would say, more on the consumer side of things. So, there's a lot of support for, we do a lot of work with our conservation groups, because again, as a pet food company coming in, yes, we are the largest in the United States. We are second largest in the world. There's a lot of use of resources. And so we also then have a responsibility to give back, not only to Mother Nature, but then also to the communities that we affect. And so that's one of the things where I feel really, really strongly about the work that Purina is doing in living and breathing our belief that, your pet, our passion, and that people and pets are better together. So we have a lot of really amazing philanthropic initiatives. One around domestic violence and creating shelters that are pet friendly. So that way the survivor and their pet can stay together. Yeah. And that's just one where I'm like, oh, yes, we are doing the right thing. I also do love what we are working on in the veterinary space of the veterinary mission support. And so that's where veterinarians can apply for a grant. Each veterinarian, $1,000 that can help when there is that kind of Good Sam case that comes in, or that client that cannot afford it, but you feel really passionate about wanting to be able to help. We've donated over $2 million through this grant program to the veterinary space. And again, to me, that's another just outward sign of really helping to support the veterinarian and really understanding those pain points that come along with the profession of wanting to help and heal. And sometimes finances are that barrier.
Yeah, I really love that, because that's a trickle effect. You help the veterinarian, but that in turn that helps the hospital.
Yeah.
It helps the client, it helps the patient.
Yeah.
You're doing so many things with just one action.
Yeah. Yeah.
I love that. If you could redesign the sponsorship model in veterinary media and education, what would you prioritize? Equity, transparency, or innovation?
Oh, I have to pick one.
Yeah. There's no right or wrong.
All of the above.
All of the above.
No, and I do think they kind of are all, they're so interwoven together, where I think if you start focusing on this equity and inclusion, the innovation train just gets ramped up, because now you've got this diversity of thought, diversity of perspective, diversity of life experience that's going to come at some of the maybe things that we are always butting up against, that suddenly someone with a different life experience and perspective can come in and bring that unlock. And now there's a big innovation that hits this industry. And so I think, I joke that I want all three, but I do think they are all kind of hand in glove together. And so, but I think if I had to push for one, I would say equity, such that it can have that ripple effect that changes how we treat and communicate and all of that for our pets.
Yeah, I think that that also helps. Again, that also definitely helps your bottom line too.
Yeah.
In a positive way.
Right.
Should sponsors be required to support mental health and diversity initiatives in vet med as part of their corporate social responsibility?
I would say yes, because if that's not ticking along, I hate to say required. I would think that would be something fundamentally that a sponsor would want to do and want to support. And I think that's, and maybe that's because I'm coming from the Purina bias where we do these things. We have the veterinary support mission. We have, programs to really highlight what the benefit of having pets in the home can do, and the diversity programs and things of that nature. So again, maybe I'm coming at it from a little bit of a bias, but I think it should be something that a good company wants to do and feels impelled to do, not that they have to do it to check a box.
Yeah. And, I'll even add in, if our leader company can do it, why can't anyone else?
Yeah.
Good job, Purina. Last question.
Okay.
What would it take, not hypothetically, but practically, for veterinary medicine to become more joyful, inclusive, and financially viable as a career path? Last one.
Yikes, you saved. I thought the other ones were hard, and this one you just come in with the really tough sucker punch right at the end. I think I look at it from the aspect of kind of something you talked about earlier, as well as like getting involved at that community level at that early stage, in a way where, and I've seen, some practices do it. We at Purina have a youth outreach in the local St. Louis area, where we have students come in and kind of do a tour. But I would love to have like a really true like day in the life of, where it's a bit of a more structured program, or maybe it's a summer, a week of a kid's summer where there's a veterinary camp and like they're in a clinic so that they better understand kind of all of the, the nitty gritty. And I think knowing how, and I only have one son, but just knowing how inquisitive he is and how much he picks up on, I do feel like, like a week of a summer camp for a kid at a vet clinic and maybe it's sponsored by industry, right? And so they start to better understand everything that's involved, in a practice, or as an industry veterinarian, or, working for the USDA or something of that nature, with all the wonderful things you can do with a veterinary degree. But having that early exposure, so that they don't have this pie in the sky vision of all veterinarians do is play with puppies and kittens all day long.
All right.
I would love to say we do. And sometimes we do get that opportunity, but that's not the usual. And so, but it does help to really get the reallys for them. And so then if they are thinking about that, they can start that earlier career path and maybe have that mentorship go on that helps to guide them to ultimately, their doctorate of veterinary medicine.
Yeah, I love that. And let me know when you're ready to start that program. I will record and blast that out. Purina, you guys should get behind this.
Perfect.
This should happen. Well, Dr. Lobos, thank you for lending your voice, your experience, and your fearless honesty. This conversation challenges us not just to talk, but to act, to lead, and to advocate for a future that honors both pets and the people who serve them. We're grateful to you and to the companies and communities willing to stand behind this vision. Thank you so much.
Yeah, well, thank you so much for having me. This was a wonderful, however long, 45 minutes.
Right. Yeah, you did such an amazing job, and with so much honesty and so much truth. You have so many nuggets in this that people need to pay attention to. And I am definitely going to get that out there.
All right. Well,
Yeah.
thank you so much. This was fun. I'm glad we finally got it to work and got the date and all that.
All right. Well, thank you so much. And let me know if you need anything. Ladies and gentlemen, this is Ryan from Athletic Conceptual Training, and you guys all have a great day.
Thanks.
Bye.